What's up, YouTube? It's Victoria. Hopefully you can hear me. This is my first time ever going live. So hi, how are you? I'm here at work and I'm here working on, well, this is on Psych series number 3, actually, for depression. Yay! So if you are a subscriber, thank you for subscribing and supporting me. If not, tap on the subscribe button, the bell, and that way you'll be updated on new videos that come up. Okay. So the previous one that I did was on anxiety, and the first one was on how to choose a counselor. Okay. This one today is going to be on depression, especially since I mean, it's Rona, it's COVID, look at the significant changes that have occurred during 2020. Okay. So not surprised if mental health, okay, symptoms and such have spiked. Okay, so this one specifically with depression. Okay, so what is depression? A lot of people misconstrue it or get it mixed up with just sadness. Okay, mental health or with depression. Okay, yeah, there's sadness. There's isolation. There are some other symptoms that go along with it, but it's chronic. Okay, it's a lot of the chronicity here. Okay, so depression are quite a few symptoms. Okay, and it's much more than just sadness. Okay, it's feeling helpless, hopeless, or worthless. Okay, difficulty sleeping. So people with depression will have either insomnia or hypersomnia. So insomnia is like shortened sleep or difficulty falling and staying asleep. Hypersomnia means that you're sleeping too much. Okay, so this is sleeping all day, every day, even while taking naps. Okay, you'll have the fatigue, thus taking the naps and feeling tired. You remember the little what is it, Zoloft commercials where it's a little bouncing head and you said like depression hurts. Depression does hurt. People will feel, especially if you have chronic pain, okay, will feel more intense body aches and pains. Okay, this is going to be a lack of motivation, so you're not feeling motivated to do anything. Okay, and this leads to anhedonia. Anhedonia is not having the motivation to do the things that you used to like to do. For example, any hobbies, let's say you collect things. Okay, let's say you like to go fishing. Now it's like, I don't feel like doing it. I don't feel like fishing. I don't feel like doing shit. Okay. Quite frankly, that's what it's like. Okay. So that's anhedonia. There could be some changes in appetite. Some people don't eat while others will eat. It just depends on their symptoms. Okay. Like how intense it's impacting them. And if they're overeating. And plus, you'll notice too the type of food that they're eating. It's very grainy carbohydrate, very comfort type foods. Okay. Pastas, bread, sandwich, stuff like that. Okay. Sometimes people will have, and it's not suicide, you're feeling suicidal. It's a lot of the suicidal ideation. So thinking, and it's more passive. Okay. So it's not thinking, oh, I'm going to kill myself on this day at this time. It's more so, if this truck runs over me while I'm driving, then so be it. Okay. Sometimes they can be fleeting, which means it's very brief. Sometimes it can last for longer periods of time. Okay. People tend to isolate themselves or withdraw themselves from people. Um, even family members, even their own children. Okay. Finding themselves not feeling purposeful. Okay. So these are just a few of the symptoms that occur. According to psych guidelines, if you have, I believe it's either 5 or 6 of these symptoms, usually manifesting at the same time, that's you qualify for depression, for the diagnosis of depression, at least lasting for 2 weeks. So they say. I'd say for at least 3-4 months ongoing. Okay. So the wonderful world of depression. Okay. This can come out of nowhere. Sometimes there isn't even a trigger for it. Sometimes it comes out of the blue. Okay. Sometimes it can be triggered by memories. Okay. So anniversary dates. Around this time in the summer was when this terrible thing happened to me. Okay. Sometimes that happens. Sometimes it can be watching a movie that reminded you of something okay, or during that period of time. Okay. How it impacts you, it's depends on your resiliency, how you brought up to handle certain things. Okay, so it definitely can impact your work. Okay, where you find yourself calling off of work more. You find yourself feeling sick more, and that's because depression, a lot of mental health issues, okay, can impact the immune system. So allergies, okay, any colds, flu symptoms, what would normally fight your, these viruses or these bacteria and stuff, it's going to be suppressed some. Why? Because when you're stressed, cortisol, okay, that fabulous little stress hormone, suppresses the immune system some. And when that's ongoing and repetitive, your ability to have that strong immune system gets shrunk down little by little each day. Okay, so impacts your work, your difficulty concentrating as well, poor focus. So how able are you to focus on doing things at work when you have a lot of stuff going on in your head, a lot of stuff on your plate that you are sad about or you're worried about? That's why that happens. Okay, it can impact you in school if you're in school. Same concept. Okay, it's happened, and this could impact your personal life or your social life. Okay, those that you considered real close to you or you had very close to you were supports, you push them away, and it's not because you're being an asshole and you're like, no, I don't feel like doing anything, blah. No, that's not the case. Okay, what it is you want to be by yourself. You feel like a burden. You want to be left alone, to be with your thoughts and not bring anybody else down. That's what happens. All right, there are physical changes. And kind of like I said, in anxiety, it is not all in our head, right? So there are physical changes that occur within the body. Two main ones. So within the brain, there are changes in the brain when you get any type of imaging done. Okay. The depressed brain. So you have obviously different lobes in different areas of the brain. Two of the main ones are the prefrontal cortex or the prefrontal lobe, which is like our challenging, higher learning type areas, okay, will shrink in size. And the same thing with the hippocampus. The hippocampus helps to make newer memories and stuff, and it just decides to shrink in size, okay, because of the depression, because of this change in the chemical system in our brain, okay. Also, what gets impacted are your labs. Again, look at the cortisol levels. Okay, same thing. Hormone changes. They could even cause changes in your thyroid. Causes a lot of things. Okay. How this gets passed on or how this impacts people, it's not entirely too sure. Okay, there are high genetic factors. Okay, a lot of mental health disorders, people don't realize that a lot of them can genetically be passed on. Okay, but it's also too, could it be a possibility of an environmental factor as well that kind of causes it to erupt or appear? Not entirely sure, but I have seen on my caseload or in my caseload, you know, either or both. So I guess it just depends on how it's manifested, how it comes up, and how you handle it or are unable to handle it. There are so many treatments for treating depression. I don't like going straight to medication right away because if you're able to do it with talk therapy, I have a master's in counseling psych, so I try to figure out how things happened or came to be, and we try to figure out how to work through it. Okay, so a lot of the more popular ones are CBT, cognitive behavioral therapy, even use of dialectical behavioral therapy to kind of help work with the thinking, the cognitive distortions, like I'm worthless. Okay, so let's do some empowerment type exercises, such in that nature. Okay. The, our style of therapy, we assign homework. How the hell else are you going to start using those skills and getting better if you're not going to use it and just practice it in session? This is why we do this. Okay, so we'll recommend tools, apps, journals, which I have a shit ton of for my patients, music, exercise, things of that nature to kind of help improve your overall well-being. Okay, If you have to go the medication route, and sometimes people do, it is not a terrible thing. People need medication. Okay. If that is enough of a tool to help you remove or kind of take the edge off, then so be it. Okay. Will you have to be on it for the rest of your life? Depends. But just know that you will have to be that much more vigilant and aware of your symptom changes, your mood changes, and everything. Okay. Just so you know that. There are different types of medications if we go that way or that route. SSRIs, serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine. You will end up discussing this with a psychiatrist or a psych nurse practitioner, which we have here both at our practice, and they can match you best with medication. Okay, they do an initial intake, get a good history. Of course, they read our notes and stuff to kind of get a feel for what's going on. And what they'll ask also too is if anybody in your family has depression, okay, what medications work best? Because 9 times out of 10, let's say if my mom is on Cymbalta, which is an SNRI, okay, the likelihood of Cymbalta or even Effexor, which is also an SNRI, working for me will be higher than, some other medications. Does that exclude any other medications? Hell no. But within the family likeness, how you metabolize things, with the medication stuff, it'll work, or it would be more likely to work than not. Okay. There's also too, if you do have depression and you have hard to treat depression, okay, where it's not just talk therapy and traditional pills, okay. There is a medication called Spravato. This is the ketamine nasal spray. Okay, it needs to be done at specific locations, which you can Google Spravato clinics or Spravato locations, and they will get you within 50 miles, I believe, of the closest one to you. Okay. It has to be done in a series in order for it to work, but so far, clinical trials, real life patients experiencing positive, the positive outcomes of it, really, really high. There's ECT. You remember the brain shock therapy? Okay. But these are controlled micro seizures, I guess, if you want to call it that. It's more specific in, at the location. It's not just like anywhere on the head now. It's a very specific location for a specific duration of time that will, what is basically supposed to happen is to kind of reset the brain. Okay. So that is ECT. Hospitals or larger facilities will have that. Okay. And also, I'm trying to think of the last one. There's the magnets. Okay. So it's almost like it's like a PEMF. So it's a pulsed electromagnetic field. There's also the deep magnets, for deep brain stimulation. Okay. So those have been showing a lot of promise with improving mood or improving symptoms of depression and anxiety and other things as well. Okay. So hopefully, depression in a nutshell will kind of give you some insight as to what it is, some of the treatments, and what's out there for you. If there's anything else that you would like to see for the next video, comment down below. I've had some people interested in bipolar, some people interested in borderline personality disorder. Just let me know, and then we'll give you a shout out in that video. But thank you for watching for Psych series number 3, and I will announce or kind of like give y'all a heads up as to when Psych series 4 is coming out. All right. Thank you. Have a good day, YouTube. Bye.